Hello, this is a direct video reply to The Other Side 100, who's been making several videos recently about healthcare in the United States. Now, I'm actually English and I live and work in France. The reason I'm making this video is I've been off work for about the last 8 days. I've seen several doctors, and it's a stupid thing that I've done. I've pierced my finger to open some shellfish, and my finger got infected, and there were various consequences of that, and I was very ill, and I'm still not very well, but I'm well enough to make this video because I think it's important. I've spent about $7 in petrol, been to casualty twice. The doctors prescribed antihistamine, anti-God knows what, which I bought from the local pharmacy, and they made me feel absolutely terrible. I'm still not very well, still feel terrible, but the important side of this is that I have paid into the French national health system. Now, I don't have any private medical cover. I suppose I've spent nearly 18-20 hours in the care of highly professional, dedicated doctors. I made a mistake. I put a knife into my hand, and it's just been absolutely fantastic. I haven't seen a doctor for the last 20-25 years. I'm English, I've paid into the French system, I work here. Even those that are unemployed here in France pay into the system. I know that sounds ridiculous, but the money they get from the government when they're unemployed, some of it goes back into the system. So the only reason I'm making this video is that I'm ill. I've been off work for 8 days. I'm being paid for being off work. Yet, my mistake. I was just opening some shellfish. Things happen. More importantly, I think that The Other Side 100 makes a fantastic point, is that my neighbours probably earn a lot more money than I do, but they pay into the system. So when they're ill, they get medical treatment. When I'm working and I'm paying to the system, my money, they get treated. What's the problem? We're looking at you, America, at the moment, and not really understanding why you're so individualistic. What is your problem? Okay, I might not like my neighbour, but his health is as important to him as my health is to me. And if the system helps him, oh, by the way, I do like my neighbours, we get on very well. That's not the point. The point is that we get this impression in Europe that you don't care about your neighbour. You care about yourselves and how much money you've got, and you don't want to share that money. If I see a small dog that's been injured, and healthcare for dogs in France is atrociously expensive, I still feel the same compassion and would like to try and help the little dog as I would for my neighbour. That doesn't make any sense at all. I'm rambling because I'm on very, very strong drugs, but I think you might get the point. I will help somebody who is injured. I'm just talking rubbish. I think I'm going to delete this, but you see my point. Thank you. Oh yeah, I'm supposed to do something like peace now, or I'm signing off. Do you get the point now? Thank you.